oxidase inhibitors, MAOIs, are often used to treat depression. These medications have serious side effects that the nurse will need to be aware of. The NCLEX RN exam will test your understanding of the potential side effects of medication such as lithium, tricyclics, and MAOIs. The first medication question comes from Test 4, number 54, and is a moderately difficult question related to lithium. It is important to answer more difficult questions to enhance your problem-solving and critical thinking skills. The question reads, a client should be instructed to recognize beginning signs of lithium toxicity. Which of the following are signs of lithium toxicity? Number 1, nystagmus, irregular tremor, decreased urine output. Number 2, tinnitus, blurred vision, slurred speech. Number 3, incoordination, muscle twitching, severe diarrhea. Or number 4, mild ataxia, coarse hand tremors, difficulty concentrating. The correct answer is number 4, mild ataxia, coarse hand tremors, and difficulty concentrating are beginning signs of lithium toxicity. Clients on lithium will need to be monitored closely for beginning signs of toxicity. Initial side effects stated in choices number 2 and number 3 of tinnitus, blurred vision, incoordination, and muscle twitching are expected when beginning lithium therapy. Decreased urine output is a severe side effect of lithium therapy that would occur in the late stages of toxicity. You will need to be familiar with this drug because the NCLEX RN exam often asks questions on lithium. The second medication question we will review is the tricyclic antidepressant. The question comes from Test 1, number 63, and is fairly easy. A 66-year-old man is an ALK client taking tricyclic antidepressants. The client's wife telephones the clinic and tells the nurse that she has just found her husband lying unconscious and his empty bottle of medication on the nightstand. Overdoses of tricyclic antidepressants are: number 1, medical emergencies; number 2, serious but rarely fatal; number 3, dangerous for clients in poor health; or number 4, easily treated by inducing vomiting. Number 1 is correct. Tricyclics are among the most dangerous substances when taken in overdose. Emergency medical attention and hospitalization is needed. Serious life-threatening symptoms can occur with TCAs, and the client will likely need EKG monitoring. Overdoses are dangerous for everyone, not just those in poor health. The next topic area to be reviewed is chemical dependence and abuse. Chemical dependence and abuse is a widespread problem in the United States. A large portion of hospitalizations are due to substance abuse, both directly and indirectly. The NCLEX RN exam looks at the nurse's role with the chemically dependent client and their families. The nurse will need to provide for the physical care and psychological needs of the client. Remember that your client with cirrhosis on the medical surgical unit is more than likely suffering from the disease of alcoholism. It is important to remain non-judgmental and supportive to these individuals, as drug-dependent individuals must learn to adapt to the stressors of life with means other than the abuse of drugs. Alcoholics are not cured from the disease of alcoholism and must live day to day in recovery, often with the help of support groups. The next questions relate to chemical dependence and abuse. The first question comes from Test 2, number 56. The question reads, the alcoholic client tells the nurse he has not had anything to drink for 24 hours prior to admission. He complains of feeling anxious and shaky. Based on her knowledge of alcohol withdrawal, what other behaviors could the nurse expect him to display during the early phase of alcohol withdrawal? Number 1, coarse tremors, tachycardia, insomnia. Number 2, confusion, visual